Hello! My name is Autumn, as my nickname would suggest. I wanted to start this streaming channel to have a place to discuss women's health care and, some of the downsides, some of the things that need to change in the system. A lot of things like that. I really want to bring attention to a lot of the issues that surround women's health care. And so this is my first attempt at doing a stream like this, so bear with me. There's going to be a lot of mistakes, and it's going to be a little awkward at first, but we're going to get through it together. So to start with, a lot of people don't actually know very much about the women's side of healthcare. So I went through and I did a little bit of research, and up until 1946, men outnumbered women just population-wise. But when we hit 1946, that balance shifted, and so women are starting to actually outpopulate men. But one of the things that doesn't have a lot of attention on it is how most of the medical field and a lot of the research that is done, a lot of the clinical trials that are done are hugely based off of men's anatomy and their results. So, I remember when I started coming into this, and I brought up basically my web browser for y'all so that you can see that I am trying to bring correct information, and I want y'all to see what I'm looking at to help make sure we're all on the same page. So let's see, what was one of the first things? Where was it? Kind of talking about, you would think on my first one I would try and have everything together, but sometimes it doesn't work like that. Okay, so that was more of that. Clinical trials, there we go. So, clinical trials, reading back onto where I'm supposed to be, because, yes. Problems. Well, we'll just go with that because it should bring up the NIH. Because there was a recent study that was done that really, honestly, kicked this off for me of why I really wanted. Oh, hey, look at that! Ha, my bad. It's a hollow. That's what I'm trying to look. Hollow. There we go. Women's Health Index. That didn't really bring up anything that I wanted, did it? News reports. Like I said, there's going to be a lot of issues when I first started this. Just 8 years ago. History of women's health care studies and research. If I could spell, that'd be great. Yes, we're getting closer. So, I know this is the AI overview, but we can also go back into things that I've actually pulled up articles on, but this brings a lot of it. So before 1970, a huge amount of medical research was only studied on men. So that meant, vital signs, how they reacted to medications, So just a lot of things were male based in the studies, and it was almost assumed that, since a man and a woman are both human, that all of those little things would kind of branch over to each other, even though because atomically, from a very basic point of view, the only thing really different anatomically from a woman and a man is an organ. So there just didn't seem to be a big need for studying women's health. And we're going to get into some statistics on this particular one. Let's see. 1960s civil rights and women's right gave rise to the women's health. So about 1970s, we actually started talking a little bit more about the issue of how, just like I've been repeating myself. All right, let's see. We got a nice timeline here now. I'm looking for statistics. Wow, cannot spell, and everybody gets to watch me do it. Status of research. Aha! This is what I was looking for. Okay, so women's health remains underfunded and underrepresented, with only about 7% of healthcare research focusing on conditions exclusively affecting women. And so this is what I mean when I was saying earlier that there's just not a lot of research and there's not a lot of clinical studies that are really focusing on how our bodies are different. So, in, let's see, what was it? Yeah, as of 2019, women accounted for only 40% of participants in clinical trials for cancer, cardiovascular, and psychiatry. And, if you sit down and think about that, 40% of an entire test that's already on a small scale are women. It's just not, what's the word I'm looking for? It's just not focused on. Let's see, there's also, massive investment gaps whenever it comes to, government funding for this research. Only 10% of women report being tested for any kind of cancer. And then misdiagnosis, there's just this whole big mess when it comes to women's healthcare. And it's so funny because I know men and women who constantly complain about the healthcare, and they're constantly upset because they feel like they're not being heard, or that people are either throwing prescriptions at them all the time that just don't make anything better and also have really bad side effects half the time. And from what I understand, just from people that I have in my own life and people that I've talked to a little bit here and there, I feel like a lot of women go to the doctor and just feel like they're not heard. Or even worse, I know I constantly in my own life had the answer of, well, I don't know what's wrong. And I'm sent out the office with 7 different medicines and no answer and not getting better. And, that's another thing that motivated me to start this channel and start this podcast, or at least I'm hoping it'll be a podcast one day, to really get a lot of people, men and women, to look at these issues. And I know we have a lot of things going on in society right now that everybody's focused on, but I don't think it's ever a bad thing for people to focus on getting healthier and for more research, because you can't have any hardcore, ironclad answers without tons of research. It just doesn't happen. There's just a lack of data. So, let's see, I just want to make sure that I have other things pulled up right now. So let's see. Let's talk a little bit about like kind of what they're seeing from surveys and stuff right now. Let's see. Yes. Women right now have some of the highest rates of skipping needed health care because of the cost, or they're not satisfied with their care. And I hate to put it this way, but it does seem to be like well, if the doctor's going to tell me that they don't know and they're just going to throw the kitchen sink at it. By the way, I just learned that term recently. Thank you to the person who taught me it. Throw the kitchen sink. I mean, what is the point? Because a lot of the medications that we have such dire consequences that just make it not worth it. We also, we still in 2026 have so many women dying from childbirth. I mean, women have been, having children since the dawn of time, and yet the medical field still doesn't really focus on it all that much. Let's see, what is the mortality rate for pregnant women? I don't want the AI. Thank you, but no. All right, rates in 2023. And this is actually from the CDC.gov. So, but we'll click on the link just to make sure that AI isn't just saying something that it doesn't really need to be. Rates in 2023 were 12.5 deaths per 100,000 live births for women younger than age 25. 18.1 for 25 to 39 for that age range. And that, I mean, just for me personally, that is an insanely high number for us being in the modern age. Why is there not so much more research going into this when it's obviously still a problem? And it's a problem that humanity is going to have and carry over, for the rest of its existence. So why aren't we focusing on this? I mean, it seems kind of important, especially when, what's the word I'm looking for? You want humanity to be able to keep going, but we're not going to focus on how that happens. So just to, verify, and I'm hoping that some people will talk in the chat a little bit and kind of maybe give me some suggestions on how to do this better, or how this could be better in the future. So at any point, if you feel like you need to help me out because I'm not doing well, just let me know. I love and I need all of the criticism. So just so you know, these are data sources that are coming from the National Vital Statistics System, and underlying cause of death assigned to International Statistic Class for the 10th Revision Codes. Whew, man. So this site also references the World Health Organization. I don't know what that is. I'm going to have to research that later. The National Center for Health Certificates, I'm familiar with. National Vital Statistic Reports. Here it is. So you can see there was quite the increase in 2021. Oh, that was around COVID, wasn't it? And then it kind of went back down for a little bit. Your maternal mortality rate. Whoa. Well, that's kind of cool. Like, I know probably a bunch of people wouldn't like looking at this chart, but I find it interesting. So let's keep going. Status. I don't want that. Oops. So here we go. This is a really good one too. This is the the National Library of Medicine. So there are a lot of very interesting articles and studies that are put into this. You can see like a whole bunch, just the key of everything that's going on. Let's see, what's something interesting that kind of goes on to this. I also took some notes for some other things. Alright, women's healthcare. Yes. Only about 7 to 11% of healthcare research focusing exclusively on conditions affecting women. Historically, male bodies have been treated as the norm in research, leading to, among other things, only 5% of medications being properly labeled for pregnancy and significant gaps in understanding diseases like migraines and cardiovascular disease issues. So in saying that, it's like it wasn't when different. Like I remember hearing about this, and so it was in the early 2000s. There was a recent study in 2020 that just showed that women have a much wider variety of symptoms when, for something as big as a heart attack. Like, for example, we've gone so many years about hearing, if you're having a heart attack, your right arm's going to hurt, you're going to feel pain in your chest, it's going to be hard to breathe, and you're going to feel like there's an elephant. And that was the norm for so long. That's what I grew up hearing. That I know people that still think that is like the only symptoms. But then just in 2020, they're letting us know that, oh hey, no, women have incredibly different symptoms. And they can. Very, very often they do. And so if we have something that's talked about as big as that, and they're not figuring out until around 2020, like mass public-wise, that it's actually very, very different, I mean, what else do we not know that's critical to know? So I think this is about where I'm going to leave the stream. I'm gonna stop here for today. I'm hoping that more people are going to watch it and comment and maybe give me some ideas for the next stream that I do. I'm hoping to be more focused and more organized, and as soon as I know when I'm going to do it, I will probably put it on a schedule so that y'all know. I really appreciate everybody being here today, and I hope y'all have a great day. Have the best of days. Bye.